our Williamson County Board of Health. I'm going to call the roll. I need for you to indicate that you're here, and then I'll open it up for Christy to read in the legal material that she has to read. So I will begin it off first with Dr. Sam Bastian,
Here.
Dr. Charlie Beecham,
Here.
Tina
This
Hamlin,
conference will now be recorded.
Tina Hamlin, Cindy Howe,
Present.
Kathy Montgomery,
Here.
Martin Myers,
Here.
Gary Owens, Dr. Gary Owens,
I'm here.
Dr. Stillwell,
I'm here.
and Rhonda. I heard her.
Here.
Thank you. I'll go back, and the only one we're missing is Tina. Did you happen to come on? Otherwise, Christy, would you read into the records what we have to say, what you have?
Rogers Tina did join.
Tina's on.
I'm here. I'm sorry. I used to using Zoom, so and I
Okay.
had to download real quick.
That's fine. You're here. Christy, would you read what we have to read into the minutes, please?
Yes, so the necessity of meeting electronically has to be declared for the record, so that we can qualify for this to be a viable meeting under the governor's executive order. So I need someone to make a motion that due to COVID-19, it is a necessity that the Board of Health meets electronically today.
So moved. Cindy House.
Cindy Howes made the motion. Thank you. Do I have a second?
Second. Martin
Need you-
Myers.
Martin, thank you. Okay, you've heard you've heard Christie's request. We have to read what she read. I'll take a vote. I have to do that one at a time. Dr. Sam Bastian,
Yay.
Dr. Charlie Beecham, Charlie Beecham. Yes or no? Hey, Charlie. We'll go on. Tina, yes or no?
Yes, sir.
Thank you. Cindy,
Yes, please.
thank you. Kathy,
Yes, sir.
Martin,
Yes, sir.
Gary,
Yes.
CA,
Yes.
and Rhonda.
Yes.
Go back to Charlie Beecham. And I, as the chairman, vote yes. So we have 1, 2, 3, 4, 5, 6, 7, 8, 9. The vote was 9-0. We'll move on to the first item. First item we have tonight on our meeting will be the approval of the minutes from way back in September the 17th, 2019. I need a motion to approve those minutes, please.
Gary Owen would approve.
Thank you. Do I have a second?
Second. Cindy House.
Cindy House, second. Thank you. We're ready to vote, or if there's any discussion on the minutes. If not, we're ready to vote. I'll call the roll. Rogers Anderson, aye. Sam Bastian,
Aye.
Charlie Beecham, Tina Hamlin.
Aye.
Thank you. Cindy,
Aye.
Kathy,
Aye.
Martin,
Aye.
Gary,
Aye.
CA,
Aye.
Rhonda.
Aye.
Thank you. Going back to Charlie Beecham. Charlie, if you're on here and you can hear me, why don't you hang up and then call back in? That may help you open up your line. On the motion to accept the minutes, it passed unanimously. The next item is the Williamson County Health Department budget for 2020-21. I'll entertain a motion to get it up on the floor, and then we'll have a discussion. Do I have a motion to accept the proposed budget?
So
Gary?
made.
So moved.
I need a name, please. Sam, was that you?
Martin Myers.
Martin, do I have a second from someone?
Gary Owens. would you say-
Thank you. Gary Owens, second. Brian, or is Joe here? He's not here. Brian,
Joe
you
was
wanna-
here, yes.
Joe's here.
okay. Joe, would you explain the budget, you or Brian?
Well, Rogers, I think this is Cindy's budget right now.
Okay, excuse me. Yeah, this Cindy's
Kathy's
budget.
It's Kathy's budget.
Kathy, would you explain your budget?
Yes, sir, I will. So just a couple of line items where you might see larger increases than others. This year, our regional health department has told us that.
Hey,
Sir?
Kathy, somebody needs to mute. We're getting feedback. Kathy, start again.
Okay, now can you hear me better? Yes, that sounds better. Thank you. I was getting feedback too. So there might be some areas that you see a larger increase and a large decrease. So this year, the regional health office has told us that our phone system, which is almost 17, 18 years old, that there are no backup systems for it. It's an old black box system. And so if our phone system goes down, then there's not going to be a backup to bring it back up, and we're going to be in a real pickle here. So we've allocated quite a few of our dollars to a new phone system. I've been calling around. I've gotten several bids. I've been working with Rogers and the IT department to look at different options for our health department. But what I have done, I've gotten really low bids. I've gotten really high bids. And then I've gotten some that are probably about medium range. So I've kind of split the difference and gone there. I might have to move a little bit of money around, but that's what we're going to be having to do this year. I can tell you that property management and the county has done a phenomenal job, you know, with our new lighting, with our new AC units, with some new electronic control, so to speak, on our facilities. And our utility costs have really plummeted. So that's a great thing. So that allowed me to move a lot of my money over to that communication line item for my new phone system. And I'm happy to entertain any other questions about the budget.
So this is Roger speaking. Just as an overview, if you will notice in the top right-hand corner of your proposed budget detail, there's probably a timestamp date of that. That timestamp date on my copy is reading at 3/20, March 20th. Since that time, the budget committee has gone back and put out new guidelines. So in those areas that you may or have a copy showing some increases in, the following guidelines are for all county personnel: no pay raises, no new people. All capital items will be reviewed, and that's what Kathy was talking about. The only exception to that was the longevity pay that may or may not be in some of these budget, but it's been trimmed down to a status quo budget from the same as we had last year because of the particular situation we're in with our revenue streaming. And we have also asked all the department heads to be prepared to even take a 5 or 10% cut with no extra, not addressing any of the personnel. So that went out today. So this budget is a little premature, but the overall budget is a status quo budget except for the longevity pay of our personnel. We've left that in for the time being. Any questions to Kathy or myself?
Kathy, this is C.A. Stillwell. I hate to bring it up, but
We're going to pay for contact tracing.
Contact tracing. Well, that's already being done by all of our local health department employees. And, you know, if we need assistance from the region and things like that, we can get that. Now, all of our testing that we're doing for COVID right now is being provided by the state health department. So that's not coming out of our local budget here.
That's good.
Other questions? Great question. Well, at the end of this meeting, if all of you are still we'll give Kathy to give an update on what's happened in Williamson County over the last week. Any other questions on the budget? I don't see any, so we're going to do roll call. I'm going to do roll call again. Brian, I hope Shauna's doing all this. Brian, is she doing this too?
Yes, sir, she is. She's taking notes, minutes.
Thank you. All right, I'll start at the top and come down. Roger Sanderson votes aye on the budget. Sam Bastian,
Aye.
Charlie Beecham.
Aye.
All right, back to it. Tina,
Glad to
Aye.
be with you guys.
good to have you, Charlie. Tina voted aye. Cindy House,
Aye.
thank you. Kathy Montgomery,
I'm not sure if I'm allowed to vote on this, Rogers, but if I am, aye.
you can vote on it. Martin Myers,
Aye.
Gary Owens,
Aye.
C.A. Stillwell,
Aye.
and Rhonda Watson.
Aye.
Vote was unanimous for item number 1 of the county health department budget. Item number 3, the Department of Sewage Disposal Management, the 2020-21 proposed operating budget. Do I have a motion to get it up on the floor?
Cindy House, so moved.
Thank you, Cindy. Do I have a second?
Sam Bastian, second.
Thank you, Sam. And a second. Questions that you can direct to Brian or Joe? Again, I will say before I get off the mic, if anybody wants to ask a question, the guidelines are the same for this department as I just described with the health department too, that are county funds in the health department. The state operates part of that too, but this one is clearly all county sewage. Questions? I see none. Y'all ready to vote? All right. We'll start. I'll start first. Roger Sanderson, aye. Sam Bastian,
Aye. Aye.
Charlie Beecham,
Aye.
Tina Hamlin,
Aye.
Cindy Howes, come on, Cindy. I see you go up and down in your head. You go. Martin Myers,
Aye.
Gary Owens,
Aye.
thank you. C.A. Stillwell
Aye.
and Rhonda Watson.
Aye.
Vote was
You forgot Kathy.
Kathy,
Aye.
I'm so sorry. How did I do that? All right, moving on to item number 4, resolution of the Williamson County Board of Health adopting a policy of authority within the Department of Sewage Disposal Management. You gonna talk to this, Brian?
Either I can or Christy, but I guess I can. And Christy can chime in since she actually drafted the resolution. One of the things that the board, especially the board members that have been on a while, you might remember we had a previous resolution of authority that basically gave signature authority for the department when the director was not present or when the director was absent, if the director was on vacation or for whatever reason. And the previous resolution, the next person in authority to sign things was the assistant director or deputy director. And currently, the way the organization of the department is, we do not have a position designated as a deputy director or an assistant director. So the next person available to sign any kind of documents would be the chairman of the Board of Health, the county mayor, Mayor Anderson, in conjunction with the office manager. So we were looking at trying to revise that and get it more current with the way the department is structured now. And so that's what this resolution does, is it changes the signature authority to sign things such as subdivision plats or any other kind of official department documents. And the way that this new resolution is set up, it would be the authority would go, the department director would be first, and then in the absence of the director, a designee of the director of the department as appointed by the director on an annual basis and then confirmed by the Board of Health. So that's the big change. And then the third person or the third person with the signature authority in the absence of the director or the director's designee would be the office manager concurrently with the county mayor. So in essence, that's what this resolution does. It replaces our previous resolution with this new one. Christy, is there anything else I need to add to that explanation?
No, I think you covered it.
Okay, thank you, Brian. We'll get a motion and we'll have discussion. Do I have a motion to approve the resolution as outlined by Brian?
So moved. Sam.
Thank you, Sam. Do I have a second?
Second by Gary Owen.
Thank you, Gary. We'll start the roll call. Rogers Anderson, aye. Sam Bastian.
Aye.
Thank you. Charlie Beecham.
Aye.
Thank you. Tina Hamlin.
Aye.
Cindy Howe.
Aye.
Kathy Montgomery.
Aye.
Martin Myers.
Aye.
Gary Owens.
Aye.
C.A. Stillwell.
Aye.
And Rhonda Watson.
Aye.
Resolution passed unanimously. Thank you. The next item we have on our agenda tonight is the number 5, confirmation of the designated representative of the Department of Sewage Disposal Management in the absence of the director for the year 2020. Brian, you want to talk us through this?
Yes, sir. So in accordance with the resolution that we just passed, we wanted to go ahead and nominate someone to be the designee for the department in my absence. And so we have to do that on an annual basis. So for this current year, for 2020, I've designated Bart Skelton to be the designee in my absence. Bart's actually on the call. If anyone has any questions, they can ask Bart. But just to kind of refresh folks' memory, a lot of y'all have met Bart in the past. Bart's our senior staff member. He's been with the department for 24 years now. He's a licensed soil scientist, but he's currently right now he's in charge of reviewing all of our subdivision plats and location maps, and also training our newer employees in reviewing those documents. In times past, Bart's kind of helped me run things when I've been on vacation and whatnot. So this would be designating him for the remainder of 2020 until the first regular scheduled meeting of the Board of Health for 2021, at which time I'd have to renominate someone else. Okay, Rogers.
Yes. Who was that?
That's all I had on that,
Okay.
Rogers.
Thank you. Do I have a nomination for Bart to be this person that has any representative? Need a motion.
Charlie
I'll
Beecham.
move.
CA.
Charlie Beecham made the motion. Do I have a second? Was that you, Dr. Stillwell?
Second. Yeah, I second is CA Stillwell.
Thank you. Any further discussion on naming Bart as the designation to the first of the year of 2021? If not, we'll call roll and get that knocked out again. Roger Anderson votes aye. Sam Bastian,
Aye.
Charlie Beecham,
Aye.
Tina Hamlin,
Aye.
Cindy Howe,
Aye.
Kathy Montgomery,
Aye.
Martin Myers,
Aye.
Gary Owens,
Aye.
C.A. Stillwell,
Aye.
and Rhonda Watson.
Aye.
Thank you. The vote was unanimous. Let's see what I've got next. I think that's everything we've got, right, Christie or Brian?
Rogers, Kathy had given us some supplemental information on her contact numbers. I didn't know if she wanted to talk about that in other business.
Okay, Kathy?
Like I have been doing the last couple of years, this is a report that I do for Rogers annually, just to kind of take a look or a snapshot of the number of patients that we're actually seeing through the health department by zip code, and then looking at the total number of patient encounters. So the first column will tell you how many duplicated or unduplicated patients that we have, and how many, and then the second column kind of shows you how many services. So they may have come to us for one service, or they may have come to us for multiple services. And then I did a comparison to where we were in 2018. If you remember, in September of 2018, we actually transitioned to electronic medical records. So we had somewhat decreased, the number of services we were able to provide as we were trying to transition over to that new electronic record. And in March of last year, we actually transitioned to a new 10-WIC system. So that was the electronic EBT card. So it did take us a little bit of time to transition there. We are really, really seeing quite a few WIC now, and the individuals that are on it seem to really like the use of that. We did see an overall 9% change negatively in the number of total services and patients served from 2018 to 2019. Some of that could very well be because, and this was only, we're only looking at Williamson County residents. We're not looking total at, residents that we saw from other counties surrounding us. But that very well could be because of that transition and still trying to get up on electronic medical records. I can tell you that our numbers will probably look even a little bit lower based on how long we're going to be involved in COVID activities over the next few months, because we've activated our continuation of operation plan back at the 1st of March to really focus our efforts more on COVID. So our services are really minimal right now, but we are continuing to provide those essential services for patients. So, for example, we're doing all of our WIC counseling via phone. Heck, our patients may not want to come back after that. They're really liking the service that's being provided there. Death and birth certificates, we're trying to do those via mail or run those out, kind of courier to the parking lot, med refills, trying to really reduce the number of people who are coming through our clinic right now, or having to come into the facility.
Are there questions on Kathy's report that you have before you that would read Williamson County Health Department, Franklin to Fairview Clinic? It's got a date on it, January 1st, 2019 through December the 31st. Any questions that any of you may have about the report? I don't see anybody waving their arm. Kathy, while you've got the microphone, would you kind of give the Board of Health a synopsis of what's been going on at your department for the last month, but not a full month?
Absolutely. So we have been doing COVID testing at both our Franklin and our Fairview sites. We've probably started that about mid-March. So for the last month, that's what we've been doing. Our numbers have been running about 15 to 20 on average per day. And so this past Saturday, we were gearing up for a testing, that the governor had kind of relaxed and the department had testing everyone, whether they were symptomatic or asymptomatic with COVID symptoms. So before, understand that most of our folks coming through the health department to be tested, and we were doing everything via drive-through, were coming to be tested that were symptomatic. So we, based on the numbers that we had seen, were not prepared on Saturday for, you know, a stack of about 200, 300 cars in line by the time we opened up our testing site. I will tell you that we tested from 10 until 3 on Saturday. We tested 663 individuals and were dog tired. So we have been working with Todd Horton and EMA, and we went out to the Ag Park, moved out there. I mean, within a 24-hour period, I met with the mayor and Todd Horton from EMA on Sunday at noon, and by noon on Monday, we were running cars through the middle of the Ag Park and already had our COVID lane set up and started testing. We tested 373 individuals yesterday and tested 438 today. So it's been Mr. Toad's wild ride around here.
Kathy, if you don't mind, share the times if they would like to be tested or they have friends. Would you tell them remainder of this week through Saturday the times and what are the requirements to be tested?
Absolutely. Anybody can be tested, whether they have symptoms or no symptoms. They don't have to be a Williamson County resident. They can be tested from 10 until 2, Monday through Friday. And this Saturday, our county will be testing for the whole region from 9 until 12 at the Ag Center. And we're going to stay at the Ag Center. I did want to point out too, Mayor, if it's okay, our results from Saturday, I mean, I can just say, you know, what we received as of Sunday, our results are coming in very, very quickly. They're coming in within 24 hours, and probably by Sunday evening, we had gotten about 600 of those results and very, very, very few positives. And, you know, some of those weren't even in our county, because if they're, you know, even if they're coming in from Davidson or some of the other local counties, we still have to make that contact tracing call to let them, to alert them whether they're positive or negative. The beautiful thing is that we've set up at the call center at the Emergency Operations Center. We have pulled some school nurses that are coming in there. They're actually calling all of these negatives for us and helping us, along with Parks and Rec folks. So it has really been an agency effort. Let me just say that, okay? A multi-agency effort.
And I might say, on behalf of Parks and Recs, Dusty Roads, the Ag staff, and quite a few people outside of Kathy's jurisdiction, that no one resisted going out and helping and pulling these numbers, from the parking to the alignment of it. It's been very successful, and there'll be no testing at the Franklin side nor the Fairview side so long as the Ag side is up and running.
Correct.
Are there any questions that you'd like to ask Kathy about it, or Brian about any of the events that are going on? So I see a hand popping up right there. Tina?
I'm not sure how to raise my hand virtually, but yeah, I have a quick question. Kathy, what is the plan, or is there one from the state of Tennessee regarding antibody testing?
Tina, we haven't heard anything yet about that. We haven't gotten any notification yet. I don't know if that, I mean, I think right now we're just in testing mode, but as far as antibody testing, we don't have any, we haven't heard any word from the state.
I haven't heard a word either, and I've had a few questions about it.
But I do want to say publicly on this call that Tina was very instrumental, and thank her so much, because she was instrumental in getting a lot of her nurses on board and helping us either out at the testing site or in the call center. And I'm telling you, there's a lot of calls to make, so negatives and positives. So thank you, Tina.
You're welcome.
Sam, are you in a position to give a kind of a synopsis of what's going on at the hospital with blood assurance and what's going on there?
Yeah, we have, so we had interest in certainly clinically there at the hospital, and then in the community of patients hearing about the use of convalescent plasma and wanting to donate plasma, patients who have recovered from a COVID-19 infection. So we did, working, Patty Walton there, director of the lab at the hospital, working with Blood Assurant, did harvest some convalescent plasma from at least one patient. One patient can donate enough plasma to supply 4 patients to be treated with COVID. So I think it's been used 3, maybe 4 times at Williamson, and the early indications were that all of those, the first 3 anyway, had positive clinical responses. So no acute side effects. We're very excited about the fact that, this is seeming to be heading in the direction of a viable treatment option. It's they're using it as experimentally with the study that's going on out of the Mayo Clinic. So we have signed on to that, and that's how we're able to do something that's, it's certainly an off-label use of that. So it's very promising. And we're very fortunate to have Blood Assurant who helps us with that. I think Vanderbilt is now using the Red Cross. I've seen some of their commercials and advertisements on TV about that. But we kind of got in first with Blood Assurant down here in Williamson County.
Thank you, Sam. Are there other comments? I see somebody sent something on the chat. Anything else that you want to discuss at this time? I don't hear anything or see a hand shooting up on the ones that are on camera. Then I'm going to ask for a motion to adjourn.
Cindy House, so moved.
That's a proper motion, and I see a whole head. Second. Martin, thank you. We're not going to take a vote on it. We're just going to do it. So thank you very much. Hopefully at our next meeting that we will have in May, the governor's return to normalcy, maybe we'll be able to get back in our meeting. Although this was pretty convenient. I like this very much. Pretty convenient. But that particular order, he'd have to reinstate that for us to do it again. Anyway, have a good evening and thank you very much. We will see you in May. Bye-bye.
Good night.
Thank you all. Good night.
Good night. Thank you.